The title of our case study is called Gut-Wrenching Decision.
I'm Amanda.
I'm Emma.
And I'm Gia.
So here we have the table of contents. It just kind of overlays and lays out exactly what we're going to do for the project. And here we have background information.
All right, Elizabeth Gastro, the gastrointestinal nurse specialist within the oncology unit, is visiting with her new patient, Susan McGee, within her office. Susan was sent to the clinic following an upper endoscopy procedure due to reported increased complaints of indigestion and heartburn. She is an 86-year-old female who has recently been diagnosed with stage 4 gastric cancer that has been masked by other acute assessments and has spread to her lymph nodes and other vital organs. She has been given a prognosis of less than 5 months to live with continuous breakdown of the organs leading to increased levels of pain.
Further on with the background, learning her diagnosis to be terminal, Susan has looked into participating in physician-assisted suicide. Susan is a resident of Oregon, a state in which physician-assisted suicide has been legalized in since 1997. She has read many scholarly articles and talked to multiple physicians about the process and has discussed this potential treatment alternative with her family and believes it is the best option for her personal health goals. Her husband and her family have chosen to stand in agreement with her decision and have found a physician to further explain and complete the medical process. After careful time and consideration, her neighbor Nancy and close friend Carol have agreed to be her additional non-family witnesses so that she can undergo this procedure.
So Elizabeth is a travel nurse who has been working at the clinic for the past 3 months. However, she typically lives in Ohio, which is a state where physician-assisted suicide has not been legalized. She is now faced with the controversy in providing Susan with the proper education and methods of undergoing this medical process due to her lack of knowledge regarding physician-assisted suicide, along with her internalized opposition to this treatment option. This causes Elizabeth to feel as though she will experience a difficulty in properly supporting her patient during her end-of-life journey. Elizabeth is faced with additional struggles as she believes she is not providing her patient with the ethical principle of beneficence due to her belief that the process contradicts her role as a healer and a promotion of care for her patients. However, Elizabeth believes that as a nurse, it is her first duty to provide autonomy to her patient through any means necessary, even when challenged with her own ethical and moral biases.
So our dilemma for this case study is that the nurse's ethical principle in providing her patient with autonomy versus non-maleficence and beneficence to a patient participating in physician-assisted suicide. And here is our supporting evidence.
Right, some of the symptoms and signs that Susan has been displaying since she got her diagnosis is that she has been having pain that is relieved by antacids, abdominal pain right above the umbilicus, and there is no effective treatment to get rid of the cancer without just completely removing the tumor, and that can only happen if the cancer hasn't spread to other vital organs such as the liver, which in her case it has spread to her lymph nodes. The patient can undergo chemotherapy or radiation and other anti-chemotherapeutic agents. The surgical interventions can be used, but only they can be used, but only if it hasn't spread to vital organs, and at this point it has, and so there's no other effective treatment but to either remove the tumor or to allow her to make her decision.
So first, we kind of want to talk about exactly what physician-assisted suicide is. So this occurs when a physician promotes the death of an individual through medical means. So typically, physicians work to promote and give their patients proper education in the materials which allow them to make a proper and informed, educated decision regarding their individualized process of care. And patients must meet a certain set of requirements, meaning that they typically need to have a terminal diagnosis or prognosis of less than 6 months to live. And this process has been legalized across 10 different states, and the specific method can be different for each location. So typically, some type of sleeping medication or some type of other medication is prescribed to the patient by the physician in a way to facilitate the end of their life.
So next I'm going to talk about the nursing ethical principles that's going to be discussed within this case study. And the first one is autonomy. And this is a patient has the right to make their own decisions based on their own beliefs and values. A person has the right to refuse medications, treatment, surgery, or other medical interventions. And then beneficence is a healthcare worker has the duty to refrain from maltreatment, minimize harm, and promote good towards patients. Healthcare workers demonstrate this by providing a balance of benefits against risks to the patient. And then lastly is non-maleficence. Patients have a right to no harm. Non-maleficence requires that nurses avoid causing harm to patients. And then providing ethical care. Also, nurses need to plan quality interventions to address these themes. Providing care requires that nurses exhibit ideal ethical competencies. Although all these ethical competencies are important, advocacy is especially important. Next, we're going to go on and talk about the ethical and moral principles behind the case study. First, going with the nursing ethical principle of autonomy, Elizabeth is struggling to provide her patient with the proper care to uphold the ethical principles of autonomy, beneficence, and non-maleficence. As a nurse, Elizabeth understands the priority in assisting and providing guided care in regards to what the patient wants on behalf of their medical care. In this circumstance, Elizabeth is to assist Susan in participating in physician-assisted suicide. In proper practice of the ethical principle of autonomy, each patient has the right to make their own decision based on their own beliefs and values. If a patient chooses not to receive a treatment that could potentially provide a benefit, the nurse must respect that choice. And then next we're going to move on to beneficence and non-maleficence. So basically the nurse is having difficulty with providing beneficence and non-maleficence while also supporting Susan with autonomy. So beneficence shows this with Elizabeth believes in providing beneficence to all her patients and feels that the act of physician-assisted suicide to not support this ethical principle in any way. Healthcare workers have a duty to refrain from maltreatment, minimize harm, and promote a good towards patients. And Elizabeth views her role in supporting her patient in PAS to contraindicate her role as a nurse. Moving on to non-maleficence, Elizabeth is not supportive of the idea of physician-assisted suicide and is not accustomed to this process because she normally resides in Ohio where this is not legalized. Elizabeth finds it difficult to support this idea because she believes the act to negate the ethical role of non-maleficence to her patient. Patients have a right to no harm. Non-maleficence requires that nurses avoid causing harm to patients.
So now we're going to kind of talk about the moral principles. So overall, Elizabeth is conflicted between providing care which she believes is essential and will be best for her patient, Susan. And then in comparison to this, she's also struggling with the idea of allowing Susan to make her own informed medical decisions. So Elizabeth is not normally familiar with the process of physician-assisted suicide, nor has she ever been a nurse or some type of witness in the process of physician-assisted suicide due to the fact that she normally works in locations that are not legalized, that have not legalized this process yet, or even have considered this treatment alternative. So she is conflicted and understands that this medical process has been legalized within Oregon, which is the place where she is currently working, so that her patient technically has the legal right to select physician-assisted suicide if she feels that this is what will best define her medical wishes. However, she also feels as though in aiding this process is going to go against her fundamental roles as a nurse and as a healer. So from a moral standpoint, she can see how relieving her patient's pain can be seen as more of a humane action due to the unnecessary pain that Susan is facing because of her prognosis. However, Elizabeth herself does not see physician-assisted suicide this way, but rather as a method which she believes is an immoral principle and works in ending an individual's life rather than working to promote their health and longevity. She, along with many others, have claimed that physician assistance in a patient's death compromises a professional's commitment to healing and the compassion, and also believe that this promotion and legalization is perceived as a medical process for those of functioning mental abilities would eventually lead to the legalization of euthanasia, which she believes could potentially and negatively affect those who have mental deficiencies. And she understands her role as a nurse is to do ultimately what is best for her patient, through completing care and assisting with care that follows the wishes of her patient through autonomy. However, Elizabeth is still conflicted due to her personal belief and lack of experience surrounding physician-assisted suicide. So ultimately, Elizabeth is fighting between the ideas of providing her patient with proper care that she believes is best for them by not using physician-assisted suicide and allowing her patient to utilize physician-assisted suicide, which is giving them autonomy and their personal selection of choices, which their terminal illness might have been able to take away from them within the past couple months due to her prognosis. So now we're going to kind of wrap it up with a conclusion. So additional background information, so kind of finishing out the case. So after further discussion with Susan regarding physician-assisted suicide and her diagnosis, along with her medical history, Elizabeth chooses to set aside her personal beliefs and her personal biases to help Susan undergo physician-assisted suicide. So this allowed her to carry out the ethical principles of autonomy, beneficence, and non-maleficence. So this has allowed Elizabeth time to reflect on her personal biases throughout her own practice and has now given her new insights on patient care. She has grown throughout this and now has new information and first-hand experience with physician-assisted suicide, which she can continue to utilize as she travels to other states where physician-assisted suicide could be legalized or other locations that it hasn't been legalized in order to help promote ultimate autonomy within her patients. So Elizabeth herself would still refrain from using physician-assisted suicide with her own life. However, she understands the importance of this medical choice and how important this can be for those who have a terminal illness, and the importance of ethical principles encompassed within this individualized patient scenario and other treatment plans across the border of nursing.
All right, now I'm going to provide you guys with just like educational tips for a nurse approaching a situation like this. Typically, the resource that we had used had just talked about using the nursing process when approaching any ethical situation, but one approach was called the 4-quadrant approach, and it takes into consideration the patient's preference, quality of life, healthcare indications, individual and family preference, quality of life, and contextual features. Health considerations basically just take into consideration the diagnosis, the goals of the therapy, the effectiveness of the therapy. Another thing to consider is also like, does the patient understand what is going on? Do they give full consent? Do they understand the risk and benefits of the procedure? And are there any cultural factors that play a part in their decision? Other examples that have similar ethical principles to it are individuals who have types of cancer and want to utilize the physician-assisted suicide instead of going through treatment. Individuals in states where it's not legalized but want to undergo the process. One specifically, it could be a patient who wants an abortion, but the nurse does not support the abortion and believes she's causing harm to the baby, but she also wants to support the patient in doing what is best for her and her body. Also, withdrawal of life support, DNR orders, and full codes for patients who are in a vegetative state and are not going to recover. Our first question would be, would you help a patient undergo physician-assisted suicide, and what would keep you from wanting to care for your patient throughout this process? For me, I don't know. I would help the patient go through the assisted suicide just because at the end of the day, like, I want to care for my patient the best way I know how, which is to give them what they need and make sure that they fully understand and know the risk and benefits associated with other treatment options.
Our next question is, how would you advocate for your patient if they wanted to utilize physician-assisted suicide, but their loved ones did not approve of the process? As a nurse, I think I would want to discuss with the family members outside of the room of the patient and talk to them about how it's really not our body, so necessarily it's not really our decision and our choice to be making. And with this patient being at such a vulnerable state in their life, like at this point in time, we should just be supporting them and doing whatever that they so choose in their life, and basically just providing them with as much support and love that we can during the time.
And then our final question, do you think physician-assisted suicide contradicts a nurse and or physician's role in healing? So personally, I've talked about physician-assisted suicide in multiple classes now, and I really do not think that this necessarily contradicts this, because you're helping relieve someone from pain. And in this case, although Elizabeth did not necessarily want to go through this process, and she was kind of on the other aspect of this and on the other side, I do believe that her overcoming her biases and working through this and helping the individual and the patient is what really was important throughout this whole entire process, because ultimately our job as nurses and as healthcare workers is to promote the health and the choices, especially medical choices, of our patients. So
Thanks for enjoying our case study.
here's our resources.